Namaskar viewers, hello and welcome to Sansad TV. I am Tina Jha, you're watching Perspective. Every year on the 24th of March, the world commemorates Tuberculosis Day to raise public awareness about the devastating health, social and economic consequences of TB and to step up efforts to end the global TB epidemic. Tuberculosis remains one of the world's deadliest infectious killers. Each day, over 4,100 people lose their lives to TB and close to 28,000 people fall ill with this disease. Global efforts to combat TB have saved an estimated 66 million lives since the year 2000. However, the COVID-19 pandemic has reversed years of progress made in the fight to end TB. As per reports, for the first time in over a decade, TB deaths increased in the year 2020. This year, the theme for World TB Day is Invest to End TB, Save Lives. As is evident, the theme conveys the urgent need to invest resources to ramp up the fight against TB and achieve the commitments made by global leaders to end tuberculosis. What is being done globally, what needs to be done, and how is India waging its battle against TB is what we will try and understand from three distinguished experts who are joining us on the program. I'm pleased to welcome on Sansad TV Dr. Urvashi B. Singh, Chief Tuberculosis Section, Department of Microbiology, All India Institute of Medical Sciences, New Delhi. Dr. Rajendra Joshi, DDG, Central TB Division, Ministry of Health and Family Welfare. And Dr. Vishwa Mohan Katoch, President, the Tuberculosis Association of India. It is one of the oldest and largest voluntary organizations in the country today. Thank you to all my guests for joining me on the program today. Dr. Katoch, let me begin the program today with you. You know, globally, the battle against tuberculosis has taken a hit because of the COVID pandemic. In fact, the world bodies are concerned that years of progress has been upended because of the COVID pandemic in the last 2 years. If I could get a sense from you on what has been the impact of the COVID pandemic in India in our fight against tuberculosis.
There was a lackfall, the people could not report in time and there was delay. And of course, now again, the rise in the number of deaths also. But I think like any other disease, actually, it has hit the TB as bad, actually. Yes, because in a very short time, the effect can be adverse. I think that's I think nobody can say there is a positive impact. And furthermore, this is the COVID changes the entire immune system too, and also particularly the lung health, entire body immunity too. So I think the effect will be negative. But I think that on the actual numbers, I think Dr. Joshi is the right person to talk to.
Certainly, I'll go back to him to understand the numbers, but just a sense of, how even the fight against TB was actually impacted because we were dealing with a new disease and, of course, which was very, very infectious in nature. We were new to this fight. So the battle against TB somewhere took a backstage. Dr. Joshi, now as we rebound from the pandemic, how are we speeding back our efforts to fight TB? Because our target, of course, is to end TB by 2025. So how are we now in this stage of recovery and speeding up efforts against this fight?
Yes, madam. Now, COVID has definitely affected the program. We were achieving a lot of things up to 2019. But when COVID came, we had a lot of challenges, especially because it affected our notification rate. People were unable to come to the center. But tuberculosis also, we helped the COVID movement by giving our services in the terms of RT-PCR machines or the trained manpower to the COVID, to help the COVID because it was a crisis. But definitely COVID affected the tuberculosis notification and the momentum we are doing. But I'm happy to share that last year, we are able to bounce back and cover the path which we had lost. We are able to notify more than 21 lakh patients last year, and we are able to learn from the COVID experience and utilize that as a knowledge also to help the tuberculosis. But definitely COVID was a challenge, but that was a crisis where all of us had pitched in, including tuberculosis program.
So how are we coordinating with the states, Dr. Joshi? We have only about 3 years left if we are to achieve this target of ending TB by 2025. 2 years of setback because of the pandemic and huge coordination with states. So in terms of planning, in terms of course, reinventing strategies, how are we going ahead with the coordination with states and union territories?
Yes, one thing we clearly understand is tuberculosis has to be fought with the help of everybody. We want a multi-sectoral approach, and we are very grateful that we have got a support from the political and higher administrative authorities in fighting the tuberculosis. And all the stakeholders, including state, health service, private practitioners, and community. Like, for example, we have trained the people who have survived the TB. We call them TB Vijeta. We have developed a scientific awareness program for them in different formats. And we are utilizing them to spread the awareness and treatment adherence in the community. And we are also involving other ministries. I am happy to share that many ministries have shown interest. Many have already gone ahead and signed a MOU with our division for fighting the tuberculosis together. We are trying to integrate tuberculosis service with health and wellness service. We are trying to involve each and every aspect, whether it is the private practitioner, corporate sector, other ministries, so that all of us together we can achieve. The goal is a bit ambitious, but definitely achievable. I'm sure with the help of everybody, there are so many organizations, NGOs, and other people who are helping, that it is definitely going to be achieved as an all-together approach.
Absolutely. So multi-sectoral efforts are underway, but it will require accelerated push if we are to achieve this very, very ambitious target that we are talking about. Dr. Singh, let me bring in you into the discussion and understand your perspective, because tuberculosis remains one of the largest infectious killers worldwide. In fact, in the year 2019, there were 3 million people globally who were unable to access diagnosis and life-saving treatment. TB was responsible for 1.4 million deaths around the world. India accounted for 31% of it. Although the number has now come down, the 2021 report, the number of reported cases, that is 21 lakh cases of TB, 76,000 deaths. But nevertheless, the number of deaths are very, very high because of tuberculosis. What are the challenges that we are facing in India in terms of diagnosing, in terms of treatment? And because we are talking about a disease which is preventable, which is curable, so what is leading to so many deaths in our country?
Begin by saying that so tuberculosis is an airborne infection, and the similarities that you see between COVID and TB are quite evident. And I think I'll come back to this and come to your question first. So the irony that we face with such a disease which kills slowly is the slow progress of disease. So the patient, once he gets infected, he may not develop disease immediately. The disease development may take longer. And once the disease develops also, the onset is pretty insidious. By that, what I mean is the patient may have symptoms which may not be too much for him to complain. He may not seek healthcare. So precious time is lost for diagnosis. So this leads to delay in diagnosis, which leads to further progress of disease in the patient. And sometimes the delays in diagnosis can lead to development of MDR in the patient. So this being an inherent part of the disease, that the presentation may not immediately appear in immunocompromised patients or in children. The disease may develop early, but often the disease may develop very late when the patient, say a few years after the infection, he gets immunocompromised due to some other ailments, then the disease may develop. Secondly, like I said, insidious onsets of symptoms, which can range from cough, low-grade fever, evening rise in fever, weight loss, anorexia, and so on and so forth. So the patient may ascribe these symptoms to something else. He may not, reach the healthcare center for diagnosis. So these are the factors inherent with the disease which lead to delay in diagnosis. And like I said, delay in diagnosis could also be one of the factors leading to MDR. Now, like I said, earlier, the patient has to reach the center. Of course, the program has made 60 years of learning and 60 years of intense efforts by the National TB program in India have led to a lot of education also. So the program is making its effort to do active case finding. But TB in a country like ours is associated with a lot of stigma. So that is another reason the patients don't like to come to a center, because they're afraid if they are known to be having tuberculosis, they'll have a social stigma. People will outcast them, and they'll be treated differently. The third thing that is of importance is, like I said earlier, it's an airborne infection. So a person who gets disease can transfer to his immediate contacts, and the contacts may not realize or may not want to be investigated for TB diagnosis. Another factor with this disease is we classically call it the stone in the pond principle of, the scientist who laid it out was called Snow. The surname was Snow. So by this, there's a ripple effect. So a TB patient may infect his contacts, but may also infect contacts who are not in immediate, not in prolonged contact. I mean, beyond the family, maybe work contacts, maybe distant contacts. The number of bacilli required to infect is said to be very small. It's said that even a single bacillus can cause infection. The infection leading to disease, of course, like I said earlier, is another story. So because of so many factors around this disease, there can be infection in a patient which doesn't get diagnosed. There can be disease in a patient where the patient may not approach. The program does active case finding, may be able to find. But because of the insidious nature of the disease and also the diagnosis has its own flaws, there may be delays in diagnosis. Treatment, adherence to treatment is very important. Some patients, they start feeling better within 1 month of starting treatment and may stop treatment, which again can lead to a more complicated form of tuberculosis, more complicated form of the drug resistant. So there are challenges within and challenges with the treatment. There are challenges with MPR treatment, which I'm sure other experts can probably shed light on. So I guess I've tried to touch upon the basic challenges we face. And I can go on, but I'm sure you have many
Certainly.
more questions.
Let me go back to Dr. Katoch. So lots of challenges pointed out by Dr. Singh. We have very less time. We aim to reach the target of ending TB by 2025. We have done this in the past. We have eradicated polio in our country through lots of efficient programs. And of course, the role of community has been very, very important. So towards ending tuberculosis, what is the role of community going to be? Especially, Dr. Singh pointed out stigma. Early diagnosis is something that, of course, awareness is needed on that front. But how to address the stigma attached to this disease?
The stigma doesn't wash away in one day, because this is a very gradual, this is a society's perception. But the positive examples, is the main campaign which the program has led so far and very successfully, is it just to give a positive picture that if you go to the clinic first, you take the treatment regularly, you are cured actually, and they stop transmitting the disease too. So I think that positive message which the government has been already been pushing, and through the NGOs, through the associations, to professional bodies. Now that in a very short time, that ad will have to be, I think that advertisement has to be accelerated, whether it is on our Doordarshan, whether on our media, like the way we're talking about COVID, So if you want to achieve something, it has to be in a campaign mode. Ultimately, because the best part is not the coalition of the people who are dealing with it is much broad actually. We have reached to the periphery, and as Dr. Joshi was pointing out, that a very broad, expansion of the program, reaching out to the periphery with the molecular test too. That came handy for the COVID. So that means we have a structure actually. So only I think advertisement in a proper way, that means repeatedly through every media. And using this, the coalition which exists today, I think the turnaround can be made actually. And the stigma part will wash away, as the time moves up actually, because that's the society's perception when they start finding something is curable. and the stigma automatically goes.
Dr.
So
Joshi, we have done it in the past in the sense that we have obviously been able to eradicate polio, but the recent example has been COVID-19. Just the first
yes,
year of the pandemic, the kind of awareness that people had, not just
yeah.
in terms of diagnosis and treatment, but also within the first year, we had a vaccine. Now, I mean, a large population of our country is vaccinated against COVID-19. Can we have a similar
Let
approach
me
towards
let
tuberculosis?
me let me tell you, the vaccine is not the answer here at all, because vaccine has been there. And to be very frank and honest, candid, the vaccine in the COVID brought down the mortality in the second and third year in the healthcare workers, in the front end workers. But the disease was contained by the public health action, by the government action, by administrative action, by the police action, by the community mobilization. See, the first wave was brought down. There was no vaccine. It was just a community mobilization, civil service, police, healthcare workers, everybody played a part. Second wave, which was much more deadly, again, the same method prevented. One more thing which has come during this time is a mask, actually. See, the mask, which was not used extensively in the respiratory diseases, that became a common usage item for the COVID. And I think that gradually the community's perception is changing. We don't feel, several people use the mask day in, day out, actually. So if the mask along with your measures, then whenever you detect a case, how many days you stay at home, I think if you use the mask, you reduce the spread also in a tremendous way, actually. So the secondary and the tertiary cases will go down. So I think that is the one armamentarian which has come. But the campaign mode approach and the community's participation, which became a success story in COVID, was, I think, that showed the way. See, the polio cannot be taken the example of that kind. Polio has been there for a long fight, actually. It was through a vaccine. COVID vaccine has played a very marginal effect in containing the pandemic, but it has played a part saving the lives. So it is the second wave, third wave becoming less ferocious. There it has played a part. But I think the only thing which is a positive part is the community mobilization. And we have a much stronger coalition of the government, public-private, which was not there actually 5-10 years back, even in the TB program.
Certainly.
So I think we have everything.
Dr. Joshi,
Only the mobilization is
let me bring in you into the picture now and understand, because so COVID pandemic has dealt a blow, but it has also given us an opportunity to mobilize our resources in a very, very less time. It's been a classic example of how we were up on our feet within the first year of the pandemic, and the way we have fought against the pandemic. We have been able to save millions of lives through indigenous vaccines. Can we have a similar approach towards tuberculosis? It remains one of the largest killers, is claiming lots of lives every year. And the fact that this is something which is preventable, which is curable. We know the challenges in our fight against tuberculosis. The only effort is to have a renewed push, give solutions, and have a more rigorous approach similar to what we had during the COVID pandemic.
You are perfectly correct. There are similarities between COVID and tuberculosis, and there are lessons learned from the COVID. Similarities are both are airborne infection. Like Katok sir said, the preventive action, like awareness, creating awareness in the whole community about use of a mask, or how to dispose of the sputum if person has got tuberculosis, or any cough with sputum, and the ventilation. These things have to be made clearly aware. Tuberculosis has got another aspect to it. It is an infection. Many of us have got infected, but we don't manifest disease. We don't break into disease. The disease occurs because of malnourishment, which we have to tackle. Disease occurs because of smoking or indoor or outdoor pollution, which we have to tackle. And COVID has also taught us the use of technology, which we can use it for the tuberculosis also. And COVID has shown to the world that India need not follow anybody. We are pioneers. We are better than most of the countries in tackling the disease. We are capable. We have got all the skills and capacity. So what is missing, like Dr. Katok rightly said, is the Jan Andolan mode. Because many people, even educated, have got a misconception that tuberculosis is no longer a big disease. It has already been tackled. We have to make people aware that tuberculosis is an eminently preventable and curable disease, but many people are still suffering even today. Many people are losing their lives. Many families are getting destroyed. And all of us have to make an effort to create awareness and see that it is cured. Second thing is all of us can bring awareness about the stigma associated with the disease, whether we are in the workplace or in our community. It is only through Jan Andolan mode that we can eliminate the disease.
Dr. Joshi, all of these also find mention in the National Strategic Plan. But I think when we talk about tuberculosis, when we talk about the people below poverty line, the lower middle income groups who suffer from the disease, their biggest worry is, apart from diagnosis, when it comes to treatment, the huge cost that they have to bear. So in terms of supporting them financially, what are we doing? Are there any programs that are currently underway which are supporting the marginalized families in terms of finances if they are undergoing treatment?
Yes, madam. In India, where I'm very proud to say that tuberculosis diagnosis is free of cost, all the treatment is free of cost. In addition, we are giving them financially because, as I mentioned earlier, nourishment is one of the important aspects to prevent and during treatment also. So through government, through what is called Nikshay Poshan Yojana, is supporting throughout the duration of the treatment by paying 500 rupees per month to the tuberculosis patient directly to their bank account. In addition, there are some areas like tribal areas and all, we are giving them extra incentive for them to travel because there are far areas where they find it difficult. So there are a lot of programs which are supporting the patient so that the out-of-pocket expense of the patient is practically nil. We don't want patient to spend any significant amount either on diagnosis or treatment. So, and we also want to support them for the nutrition by giving the Nikshay portion.
Okay, so several steps to simplify the diagnostic and treatment of tuberculosis. But Dr. Singh, how complex is the treatment procedure for tuberculosis? For those who do not understand, first, obviously we've spoken about diagnosis. The symptoms are so similar to other common infectious diseases that diagnosis gets delayed. But when it comes to treatment, is it a complex procedure? Do people stop it midway or do they complete the course?
So over the years, so much research has proven that sensitive tuberculosis, by sensitive I mean the mainstay drug is rifampicin. Predominantly in our country, we have sensitive tuberculosis, which will respond to the first line treatment, as we call it, which is 4 drugs to be given for 2 months, followed by 3 drugs to be given for another 4 months. Now, most patients would not have any issues at all, and they start responding very soon. By responding, they start feeling better very soon. Their anorexia goes away. They feel like eating food, and they're active. I mean, they're back to normal quite soon. The issues sometimes what happens is they feel that they're better now and they need not continue the treatment. While the treatment per se is not at all difficult, it's free of cost. It's directly observed treatment. So they have somebody to reach, all under the program. They can always reach the medical officer in the DOTS center, DOTS microscopy center. They just have to stick to the treatment. So like the other experts said, we probably need to educate our population, our communities, that the treatment is not something very difficult to complete, but it is, very, very important to complete the treatment and the dosage being given to them. They should not play with the dosage. They should not play with the treatment. If they do not, if the disease could get complicated, it could get drug resistant. In some cases, it may spread to extrapulmonary sites, which is further more difficult to treat. So the answer to your question is 97% of our population would have drug-sensitive TB, which is not difficult to treat at all. And the government is taking all care, like Dr. Joshi said, taking care of the nutrition as well, in addition to the treatment.
Dr. Katoch, one final comment from you on what is the way ahead. We have very limited time, but the challenge and the ambitious target, that we have set for ourselves. So a multi-sectoral approach, people's participation, all of that sounds good. But, the kind of challenges that we've spoken about in terms of diagnosis, in terms of treatment, in terms of also the cost, and most importantly, lack of awareness. So in the limited time, what should be our approach? What is the way ahead?
I'll say in one line only, what Dr. Joshi said. It has to be a mass campaign, that's the only way. That make everybody aware, that the treatment and the diagnostic facility exists, and for you, this is the center. You go here. So you'll be taken care of. I think that massive campaign will take few months to rebuild again, which was there earlier. And it can be done. The India has adjusted to the COVID and the post-COVID also. And even, I remember, many of the trials on the tuberculosis were done during this time, and they had all people worked hard even to access them, include them in the studies. So if you do a campaign, there's no chance of failure actually. Whether you reach exactly the same target on 2025 or maybe little bit this way or that way, but you can achieve the major success actually. So I think, and then obviously that cascading effect of the secondary cases, tertiary cases, which I'm repeating again, that that will come less and less. But now the reaching out and the people going to the center and facilitating them, if they have a difficulty of transport, then make the transport available. So that's what we did for the COVID vaccines actually. So improving the access, that is, there has to be in campaign mode by the government and the other supporters of the government. But then ensuring that people get the treatment, people get the care, but at the same time, you giving the benefit of the people that, if you along with the treatment, you say stop the spread also. That means using a mask, you are preventing the spread. That everybody should know that actually. So which was not that really highly focused actually. And this the Japanese used to do for any common flu for 50, 70, 100 years back also. I think that COVID has led to something which people should build on.
Absolutely. It's important for all of us, all our viewers, to understand that tuberculosis is a preventable and curable disease. And as all our three panelists have pointed out, with the proper awareness, people should understand that early diagnosis is very important if we are talking about early cure for this disease. And certainly a public participatory approach is very, very important. We've seen that during the COVID pandemic. And if similar approach is adopted towards our fight against tuberculosis, we should be able to meet our target that we have set 5 years ahead of the world, that is to end TB by 2025. With that, I'll have to wrap up the discussion today. Thank you to all my guests for joining us on the program today, sharing your thoughts with us and our viewers. It was a pleasure having you talk about our tuberculosis campaign. So that's it from us on this edition of Perspective. Thank you very much to all our viewers as well for your time.